You're all right. Go ahead.
Does prior surgery accelerate dementia?
I would say not necessarily. No, I don't think prior surgery would. I think sometimes, often when I see people, and I will ask, well, how long has this problem been going on, or have you noticed anything? And people may often date it to an event, such as prior surgery or to a family event. Well, I noticed. Is it? Okay, good. And I think that's a feature of our how we remember things ourselves. So if I'm trying to think back to what happened then, you sort of think, oh yeah, well that was that was my anniversary, and then such and such happened, or that happened that and such a day. So you always try to date things. It's part of our brains trying to put order on things. But surgery per se, I don't think is a risk factor, unless there was obviously some problem that happened during the surgery, some medical issue.
Recommended reading for carers or siblings?
I was going to suggest the Alzheimer's Society have a huge amount of literature on, or they have a good guide in Ireland, but the Alzheimer's Society in the UK, yeah, so they have lots and lots of information on it, fact sheets, and they've got lots of nice little videos as well, interviews with both people who have dementia and interviews with carers, and I think it is full of useful information. And Norma is recommending Professor June Andrews' The One-Stop Guide to Dementia. I'm afraid I haven't read it myself, but Norma has and says it's very good, so that would be another option. Practical advice, so yeah.
Contact details for living well within the community?
I'm not sure, but I guess we could Google that one as well. Maybe you could have a look there, Siobhan, while I'm talking, and we'll see. Eilish. Oh, there you go. There it is, thank you.
How safe are people with dementia when left alone at night while sleeping?
I think one of the issues when dealing with somebody with dementia, we've all sorts of, I suppose like anything else in medicine, there's all sorts of risks that need to be managed. So I think it depends on the individual very much. So I remember some years ago, I had a lady, and she certainly had dementia and was quite confused, but was managing with support. She was getting the HSE carers going in once or twice a day, and she was going to a day centre a couple of times a week, and she was managing within her local community, but living alone. And I know the public health nurse every now and then would ring me up and say, but she's living alone, and I say, yeah, but she's doing okay. It's only when things start to go wrong that you might need to consider. So for example, if somebody is at risk of wandering and going out during the night, or maybe at risk of falls and wouldn't be able to use the pendant alarm. So things like having a pendant alarm, but if they're living on their own, I was going to say you could use a pressure mat, but if you're living out, sometimes we use that, or a baby alarm if somebody's living in a house with other people, so you know when they've got up, if you're not sure that they might leave the house, something like that. So yeah, I think it varies. The one thing I would say is that you should never lock somebody in, because I did come across that once in my career, and that you can't do that because people can't get out then if there's a problem. So you need to judge it and see how things are. Is dementia genetic? Dementia per se, it's a big question, and it could be a talk in itself. If we're talking about Alzheimer's, there are various forms of dementia. If you're talking about Alzheimer's dementia, there are a very small number of families in the world, and that would be, somewhere in the region of 8 to 10 families or 15 families, where there is a direct genetic link. So that it's passed on from generation to generation. But in the greater scheme of things, and for the great majority of the population, there may be a slight increased risk, but there's no genetic test that can tell you for Alzheimer's per se that one would develop dementia or not. You could take a test which would test something for you, which say you'd be at a higher risk. Does that help? Not really, because you might never get it. So therefore you've worried yourself for the next 10 or 15 years while you're thinking about you might get dementia. And every time you forget something, you think, this is it. I've definitely got it this time. So it's not really of use. But what is of use is to you do all the preventive things that I've talked about before. There are other forms of dementia where there is a greater genetic link, but it's not genetic per se, put it like that. Something like Huntington's chorea, there is a genetic link, and I'm sure you may have heard of that. That's a particular form of dementia that strikes younger people, and there is a genetic link with that.
At what age does one become an older person?
It's arbitrary. My own mum will be 89, and she definitely doesn't think she's older yet, and she never will be. I'm quite convinced. So it's arbitrary, and actually Bismarck decided that the old age pension would be paid out at 65, probably because he decided nobody would reach 65. But hey, he's wrong. So that's where the arbitrary cutoff is 65. So it's that's when one is defined as becoming older, shall we say.
Do people who have dementia understand or have awareness that they have dementia?
I think lots of people in the early stages of dementia do have an understanding that there's a memory problem. But then as memory becomes worse, maybe the understanding becomes less. And sometimes I'm asked, well, should we remind people that they have dementia? And I think that can be sort of cruel, saying, well, you've got dementia. You can't keep reminding people of that. So I think some people have a better understanding than others, and it can be related to the stage of the illness.
I have epilepsy. Am I likely to have a greater chance of getting dementia?
No, not particularly. No, I wouldn't have said so.
Why are people with dementia sometimes aggressive and abusive?
I think it goes back to my picture at the top of the talk, with a picture of the brain and the frontal lobe. So you'll all know whenever you have a couple of glasses of wine, that you become a bit, in good form, you're smiling, happy, have another few glasses of wine, people get more disinhibited, and they behave in what we would call a disinhibited fashion. They do things they wouldn't normally do, get into fights, whatever. Obviously not this audience. So it's a little bit like that with dementia for some people, not all people by any stretch, but that the brakes are taken off. Because this condition doesn't only affect memory, it can affect other parts of the brain. So sometimes the brakes can be taken off and people can behave in a fashion that they would never normally do. And I've had people come to me and say, she's using language she would never have used abusive language before, but it's because of that, because of the illness often.
Can you say a little bit about the typical progression of the stages of dementia?
I always say about dementia that it is, there's nothing typical about it in ways, because it's a very individual illness, and every individual is different. And I think that's very important to understand when dealing with somebody, because of all the factors I talked about before, the background factors, any previous depression, any difficulties at home, so on and so forth. All this can have a bearing. Somebody's previous personality can all have a bearing on how somebody presents with dementia. So having put that caveat on it, the progression can be, and the next question after this is always, how long is it? And the variability is huge. So it could be anything from 6 months to 20 years. So it can be a very slow illness to progress, which is why it's very important that we can improve the quality of life and help people to live well in the community with it. So the progression, typically the early symptoms I outlined on the slide. So memory loss, maybe not being able to do things as well at home. So short-term memory loss, not being able to do things as well at home, maybe forgetting the odd word, maybe having some language difficulties. and it does affect somebody's functioning at home or in the community. Then that can progress to more severe memory problems, more repetitive questioning. There may be difficulties in driving, for example, or in managing financial affairs. So the difficulties with functioning become a bit more significant, and people need a bit more help around those areas to be able to manage. Then it can progress to somebody being more confused and needing more help. So, for example, needing help with being able to get meals together, to maybe have somebody living with them, or to need that bit more support, maybe daycare, such as here, or maybe respite care to help people to cope with caring for somebody like that. And eventually, somebody may well need a lot of nursing care to be able to manage. Not everybody will need to come into a nursing home. Some people manage at home and stay at home for the entire illness, but some people may need that more supported care. That's a sort of a very brief outline. It's another talk in itself. So.
If I'm interrupted when talking to somebody, I forget what I've just said. Not all the time, but quite often. More and more, I'm forgetting people's names, those who are quite well known and sometimes personally known to me.
Well, I suppose I'd need to know a bit more. I'm not quite sure what to say. Can I just? I guess a lot of us, if we're interrupted, would forget what we're talking about. Certainly happens in our house a lot, the family all talking at once. You're trying to get back to it. I suppose forgetting familiar names may be something that may be indicative, but I think we need a bit more information, and whoever it is, if you want to talk to me afterwards, I have no problem. I can answer the question.
What about someone whose memory seems quite normal but fails to find some word, usually a proper noun, in the middle or end of a sentence?
I think it's worth looking at that and maybe going to a doctor to see if there's anything, because there are lots of things that could be happening with that. I think it would be worth seeing the GP just to see if there's anything. It may be nothing, it may be just a lack of concentration, but I think it would be worth just checking it out, because it doesn't necessarily mean it's dementia, but there could be other reasons for it, as I've outlined earlier.
How to approach the subject with a friend that they might need to get their memory checked. There is a history of Alzheimer's in the family and she's very frightened. She is aged 57. She will not go to the GP.
I think it's often very difficult. I suppose it's to try and reassure somebody. I think the worry is, as I said, about if one is going to get memory checked, that somebody's going to say to you, oh, well, you have Alzheimer's and you'll be in a nursing home in a year. I mean, that's not the way it happens. It just doesn't happen like that. It is a question of gentle exploration, making a diagnosis, and then coming up with a plan as to how best to manage something like that. But that lady, whoever it is, she may be extremely frightened by the thought that she might be developing something, maybe just anxiety. I wonder, maybe just gentle talk every now and then, just to say, or maybe the friend could go with the individual, or maybe talk to somebody in the family who might be able to talk to the individual and see if that might be a way around. Or maybe just, I know with confidentiality, GP may not be able to talk to you, but maybe a family member could talk to the GP and say, look, if so-and-so does happen to come in, we're worried about the memory. We can always receive information, may not be able to comment without permission, but that might be another way to go about it.
How soon should medication be of benefit to an older person aged 90 years? She is just getting a little mixed up with her other medication. Or would we be better to manage things for her?
I don't know if she's getting mixed up with medication, maybe something like blister pack. I don't know whether that's something that's been tried. The blister pack, where you get the medication done out in a card, Monday to Saturday or Sunday, and then across the top is the times of the day, so it's more easily managed. Maybe there's home care that could go in and remind the individual, this lady, to take medication. In terms of medication for dementia, we would suggest a 3-month trial to see if it makes any difference. If it doesn't make any difference, we might decide to take somebody off it at that point, regardless of age.
That's it. Unless anybody's any more down there, any other questions? Okay.
Okay, thank you very much, and thank you very much for your attention. Safe home.
Thank you.